Rabia, there's some background noise. Is that for any reason?
This is Rabia. Rabia.
Assalamu alaikum wa rahmatullahi wa barakatuhu, and hello to everyone, all viewers throughout the globe. I'm very fortunate and pleased to announce that Nagamia Institute of Islamic Medicine and Science is going to host this live stream lecture by Dr. Abdulnaser Kaadan. A'udhu billahi minash shaitani rajim, bismillahir rahmanir rahim. I'm very excited, and alhamdulillah, we'll begin our program now. And as many of you can put yourself to mute, that will be greatly appreciated. There is a Q&A box and a chat box for participants to put their questions in. We will do justice to Dr. Abdulnaser Kaadan in giving him time for those questions and answers. And to introduce myself, I'm Dr. Muhammad Ismail Shakib, MD. I'm a nephrologist, a kidney doctor in Chicagoland area, and founder of Chicago Muslim Medical Alliance and organization, and also a board member of Nagamia Institute of Islamic Medicine and Sciences. So inshallah, without further delay, I am going to introduce Sister Alia, who is the executive director of Nagamia Institute of Islamic Medicine and Sciences, and she will start with recitation of recording of the Quran.
السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ولقد خلقنا الإنسان من سلالة من طين ثم جعلناه نطفة في قرار مكين ثم خلقنا النطفة علقة فخلقنا المضغة عظاما فكسونا العظام لحما ثم أنشأناه خلقا آخر فتبارك الله أحسن الخالقين. And indeed, we created humankind from an extract of clay, then placed each human as a sperm drop into a secure place. Then we developed the drop into a clinging clot of blood, then developed the clot into a lump of flesh, then developed the lump into bones, then clothed the bones with flesh. Then we brought it into being as a new creation. So blessed is Allah, the best of creators. All this was known recently. However, This was portrayed in the Quran 1,400 years ago, before it was discovered. How could a literate man know all that unless it was revealed to him by the Creator? I want to thank you all for attending, and Jazakumullah khair, and hopefully it will be a great event. Thank you, and Jazakumullah khair.
Next, inshallah, we'll run this video of Nagamia Institute of Medical Sciences, and stay tuned.
Nagamia Institute of Islamic Medicine and Sciences, formerly known as the International Institute of Islamic Medicine, aims to bring alive discoveries and inventions in medicine and other sciences. Through exhibitions, storytelling, and modern technology. We are a network of academics, historians, scientists, and physicians with deep subject matter expertise. We are eager to share our knowledge to create experiences that produce a better understanding of the Islamic ethos and the contributions of Muslims to medicine and other sciences. We invite you to join us to promote a scientific mindset and to inspire excellence in generations to come.
So inshallah, we'll move to the next speaker and the host of this Nagamia Institute of Medical Sciences, Islamic Institute of Medical Sciences, NIMS, Dr. Hussein Nagamia. He is a Chief Emeritus Cardiovascular, Thoracic, and Cardiac Transplant Surgery, Tampa General Hospital in Tampa, Florida. I would say all praises to Allah, and Dr. Nagamia has spent so much time through Dr. Tajuddin and other of his colleagues throughout the world in bringing this to the platform where we are fortunate enough to look for this kind of information. So alhamdulillah, we always thank Dr. Nagamia for his time that he's giving in the background for this. For an example, just now you saw Sears Tower, which is currently known as the Willis Tower. The architect was designed by Mr. Khan from Bangladesh at that time. The reason I'm bringing this out is a few years ago, it was in their introductional video when we used to go to Sears Tower because I live in Chicago. But now I think recently when I went there a few years ago, that name was not there anymore in their introductional video. This highlights the importance of what Dr. Nagamia and his team are trying to revive the Islamic history, and we greatly appreciate him. Without further delay, I would like Dr. Nagamia to please address us and give us some advice and take this to the next speaker.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Thank you, Dr. Shakib, for that generous introduction. It is indeed a great pleasure for me to be participant in this thrilling seminar that's been presented by Dr. Kaadan. I have known Dr. Kaadan for many years now, and I was fortunate, and indeed it was a great pleasure to visit him in Aleppo in Syria I think about 15 years ago. He took me to the Arab Institute of Islamic Sciences, and we had a great time. I'm sure you remember, Dr. Kaadan, what a nice time we had together. And I always look back. In any case, he's going to tell you about the Muslim contributions to the science of orthopedics, especially as applied to fractures. But I want to point out to you that the Muslims have continued to contribute to the development of medicine and medical sciences. I'm sure that you are aware that this disease that is afflicting the whole humankind today, the COVID, is such a dreaded disease. Millions of people have already died in the whole world. And yet the cure has been formulated by two Muslims, young Muslims in Germany. These Muslims, even their names have not been published. It's amazing that we don't know that this great breakthrough of the vaccine that we are going to get, hopefully, which is going to prevent millions of deaths, was invented by two young Turkish scientists, Muslim scientists, and their name is Ozam Turki, the lady, and her husband, Ogir Sabin, who founded a biotech institute in Germany 30 years ago in the quest of medicine that could cure cancer. But they invented the RNA and the chain, and they invented this new vaccine that the whole world is about to receive. So what I'm trying to say is that Muslims are continuing to contribute, but because of the atmosphere that the world has and the Islamophobia that is being propagated, these names are kept silent. They're kept under the carpet. They're not brought up. They should be hitting the headlines, but they don't. So that is the purpose of the Nagamia Institute, and I hope you all agree with that. So we'll continue our effort, and I hope you'll be continuing to join us. Thank you very much. I appreciate your joining in, and I'll hand over back to the moderator, please.
Thank you, Dr. Nagamia, for your insight. As always, we learn from your 1 or 2 minutes information. So moving to the next and the main speaker, our orthopedic surgeon, Dr. Abdulnaser Kaadan. So I have to introduce him. Alhamdulillah, mashallah, for his achievements. Abdulnaser Kaadan, MD, PhD. He's a professor, a visitor, international professor at Weber State University in Ogden, Utah, USA. Dr. Kaadan was born in Syria. He's an orthopedic surgeon since 1986, received his PhD in History of Medicine in 1993 from High Institute for History of Arabic Science of Aleppo University. He was the chairman and professor in History of Medicine Department and teacher of History of Medicine and Medical Ethics. He supervised 8 PhD and 18 master theses related to history of Islamic medicines. Since January 2017, he has been working as a visiting international professor at Weber University. He's the founder and now the president of International Society for History of Islamic Medicine and the chief editor of its journal, which is published in English. Please do visit www.ishim.net. And Dr. Kaadan has participated in more than 120 international congress outside Syria, has 65 published papers in 8 books, and has been granted 28 scholarship awards, prizes from Japan, Britain, Singapore, France, Taiwan, Germany, and the United States of America, Denmark, Switzerland, Belgium, Spain, South Africa, and Syria. Professor Kaadan was nominated for the Nobel Prize in Literature, Historical Studies in 2012 by Ibn Sina Academy of Medieval Medicine and Sciences in India. We are very fortunate here to have Dr. Abdulnaser Kaadan to give his time to address us in his journey of orthopedic surgery and enlighten us with the contribution of Muslims. Without further delay, I will go ahead and give the podium to Dr. Abdulnaser Kaadan. Thank you very much, Dr. Abdulnaser Kaadan.
Bismillah ar-Rahman ar-Rahim. First of all, I would like to express my sincere thanks to the Institute of Nagamia Institute for History of Medicine for inviting me and giving me the opportunity to be here with you today. So let's first to share with you our slide, which is, you know, that our presentation will be about the bone fractures as viewed by some of Muslim physicians. Mostly, I would like to concentrate on medieval age period. So, sorry. So, you know that when we talk on this issue, this is the title actually. And actually, I would like to mention firstly that all the issues I would like to present for this half an hour, it's included in my book, which is published about bone fractures. But unfortunately, or maybe fortunately, it is in Arabic. I want in the near future to be translated all the book into English. So it is all information about bone fractures in Islamic medicine. It is in this book. And first of all, also, I would like to mention that we have two types of books belong to Islamic civilization. The first book, which is, we called it encyclopedic books, which contains all specialty, all field of medicine at that time. And then we have another book, which is considered specialized in special field of the book. Regarding fractures or bone fractures of human body, none of Muslim physicians, they edited or wrote a book specially for bone fractures. All what is written in bone fractures, it is related to encyclopedic book. This is actually the first encyclopedic books, which is the first one written, belong to Islamic civilization, which was written by Ali ibn Rubban al-Tabari under the title of Firdaus al-Hikmah, the paradise of wisdom. This is considered the first book related to encyclopedic books in medicine belong to Islamic civilization. And this book is considered the first one related to specialty, subspecialty, which is related to Hunayn ibn Ishaq or Ibn Ishaq, which is about the eye diseases, the 10 theses on eye diseases. And this one about pediatric. This is also one of the most important books related to pediatric diseases, which is specialized book, which is unrelated to encyclopedic book, which all bone fractures belong to encyclopedic books. And this is sometimes these, some writers like Al-Razi, for example, or Rezios, he wrote two books, encyclopedic books and specialized books. This is just for an example about smallpox and measles book, which is related to Al-Razi. Now, I would like to very quickly to talk on bone fractures as viewed by three important Muslim physicians. The first one, Al-Razi, Rezios, as you know him. Razi, he talked in his book Al-Hawi, which is considered the most important book of Al-Razi, which is considered until now is considered the largest medical textbook edited in Arabic until nowadays, because Al-Hawi is very, very big book. It is kind of very big encyclopedia related to medicine. This is the first page of Al-Hawi, or the title of Al-Hawi, which was firstly published in India. And then it was published many times. The last one, it was in Lebanon. And these are different volumes of Al-Hawi, which, as I mentioned, that is considered the largest textbook of medicine in Arabic until nowadays. Of course, it was translated into Latin, and this is the translation, and European people, they benefited from this book via translation of it into Latin. Actually, when we talk on the bone fracture as viewed by Al-Razi, in the book of Al-Hawi, you know that one of the most important things regarding the Al-Hawi, that Al-Razi dies before editing it. It is a kind of material which gathered from different references, and then it was edited by the student of Al-Razi after he died. So when I looked for fractures in Al-Hawi book, it took me too much time because I have to collect dispersed material inside of the Al-Hawi book. And I try to gather all of the material related to bone fractures. Unlike that, we will see in the canon book of Avicenna, which is all this information, it is gathered in one chapter related to bone fracture. When we talk about the bone fracture as viewed by Al-Razi, one of the most important things that to say that Al-Razi, he mentioned to patellectomy when he differentiated between among different types of patella fracture, transfer and non-transfer one, and then he took on the comminuted fracture of the patella, where the fracture is consists of many of parts of bones. We called it comminuted fracture. So he advised that the best way to heal this kind of fracture to do patellectomy, to make incision on the side of the patella and to remove all the parts of the patella. It's much better for the patient on long term. Actually, this is called the Brooke method for treating the patellar comminuted patella fracture, which was described in 1937 by a surgeon, orthopedic surgeon, he called Brooke. And it's more sense to say that it is the easiest method to treat the comminuted patellar fracture because he proceeded Brooke in describing this kind of fracture. Also, we have to mention that Al-Razi in his book Al-Hawi, he mentioned to what we call it Baker cyst. Nowadays, everyone, he knows that we have what we call it in the popliteal region, a cyst. It's in the posterior aspect of the knee joint. This Baker cyst also, it was described by English surgeon. His name is William Baker. He described it in 1877. And actually, Rezius, he described this kind of cyst. This is what our modern textbook, when they describe the Baker cyst, you can see here the popliteal region. This is actually, it is originated from this side, and then sometimes it will be enlarged and to be ended here. So in the calf region, and then this is, we call it now Baker cyst. And actually, if you go back to the Al-Hawi book of Rezius, you can discover that Al-Razi, he described it, this kind of cyst, many centuries before Baker. And then let's very quickly move to the Avicenna. You know, Avicenna, he is called the Prince of Physicians during medieval age. For this reason, we approved his picture to be on the cover of our International Society for History of Islamic Medicine journal. And, you know, Al-Razi, when we talk about Al-Razi, we directly, in our mind, we can think about the Canon book. The Canon book is very important book, which is considered maybe one of the most important book, encyclopedic book, which is belong to encyclopedic medical books during medieval age. So fortunately, the Canon book was unlike that of Al-Hawi. It was finished during the time of Avicenna himself. So the most important character of the Canon book that it is very well organized book. It is extremely such as our modern textbook of medicine for us. He began, when talk about every disease, he began by talking on introduction of anatomy of the system, like respiratory tract system, for example. And then he took on the physiology of respiration. After that, he took of every disease, and he began by talking on the definition of the disease, causes of the disease, and then symptom and signs, and then the treatment, and finally the prognosis of the disease. It is exactly what our modern textbook follows. This is the Canon book, which is very well organized. For this reason, you know that it was early translated into Latin, and it was introduced to Europe, and it was very important textbook of medicine until 17th centuries in some universities of Europe. This is the Latin translation of this book. This is from inside. And fortunately, it just a few years ago, all the book, it was translated into English. And this is the English set of the book, which is available in Ghazi Publisher in Chicago. And I know that the owner of this, the publisher of the owner of this publishing house, which is Lale Bakhtiar, and she actually died maybe 2 months ago. She was originally from Iran, and she proud of Avicenna because, you know, Iranian people, they believe that belong to their civilization. And actually his mother tongue, Avicenna, it was Persia, but all of his book, it was, including the canon book, it was written in Arabic language. So this is the translation, English translation of the canon book. Actually, when we talk on bone fracture as viewed by Avicenna, he was very, very brilliant in talking on bone fractures because, as I mentioned, he followed the same system which our modern textbook related to bone fractures followed nowadays. And at the beginning, in introduction of bone fracture, he talked on what we called it delayed splintage theory. What does it mean, delayed splintage theory? It is very simply, it means that if anyone he has a fracture in his bone, it should not to be splinted immediately. We have to postpone it until few days, until the swelling to be disappear, to general condition of the patient to be improved, and something like that. This is nowadays, we call it delayed splintage theory, and our modern textbook consider Professor George Perkins, who just few years ago he died, as a pioneer of this theory. If you go to the Apley system of orthopedic and fracture, which is considered the Bible of orthopedic and fracture science in Britain, they mention to this theory. And this is the theory, delayed splintage, and they consider George Perkins, he is George Perkins himself, who is considered by this book the pioneer of delayed splintage theory. And he applied his theory on himself, and he did it in himself. And this belonged to the 80s of last century, actually. After a few years, he died. This is George Perkins. And he talked about the theory. I discovered that Avicenna, in the introduction of bone fractures as viewed in his book, the canon book, he talked about this theory many centuries before Mr. George Perkins. And actually, I still remember in the 19th of last century, I attended a conference, the largest conference worldwide. It's about the International Society for History of Medicine conference. They held their international conference in Kos Island at that time in Greece, which is considered where Hippocrates was born. And they hold their conference at that time in Kos Island. I attended this conference, and my paper, it's about bone fractures as viewed by Avicenna. And I provided to them the text of the canon book translated into English and how Avicenna, he talked about delayed splintage theory. At that time, the president of the conference, his name is John Clue, he was British. And I told the people, I could persuade them that Avicenna, before George Perkins, he talked about the theory. At the end of my lecture, I asked John Clue, the president of the conference, to send a message on behalf of all the people who participated in this conference and to send this letter to the publisher of this book, Apley System of Orthopedic and Fracture, to change this reality. And we approved to tell them that according to our meeting in the conference, that all the people recognize that Avicenna, before George Perkins, he talked on the theory of delayed splintage. And we asked them to correct this reality and to say that the pioneer of delayed splintage theory is Avicenna before George Perkins. Actually, we sent a message to the publisher and we waited for the new edition of this book. And what do you guess the result of our waiting? What they did, and this is to support Dr. Nagamia, what he said in his introduction about the problem of Islamophobia or something like that. So what do you think the result of that? Actually, we waited eagerly for the second edition of this book. When it was published, we discovered that they canceled talking on delayed splintage theory. Never mentioned to George Perkins, and they never mentioned to Avicenna. So this is what we mean. Sometimes it is very important to stress on the importance of Muslim scholars either during the medieval age or nowadays what is going on, that importance of their contribution in the field of medicine. This is just very important example to how much extent do you think that it is important to provide the achievement. And actually, when we talk about our society, when I showed you the Journal of International Society for History of Islamic Medicine, I thought about it to find such kind of organization. And we did it. And Dr. Nagamia, he remember well when we held our first international conference to find it. It was in Doha, Qatar, in the year of 2000. It was 20 years ago. And the aim of that, just to present the contribution of Muslim scholars, especially during the medieval age, because many of the books, especially in Europe, they ignore this kind of contribution. And just they devoted a few pages when they talk on the contribution of, or what is called Islamic medicine. You can imagine one of the most important books related to history, general history of medicine, which is published by Oxford Press. Actually, if you can imagine that, this book consists of 600 pages. How much pages you can imagine that they devoted for talking on Islamic medicine? Actually, I can say that they devoted only 5 pages for talking on all what was achieved by Islamic medicine. At the same time, they devoted 5 pages for talking on achievement of Leonardo da Vinci in the field of anatomy. So you can imagine, this is unbelievable thing. But nowadays, alhamdulillah, after establishing our organization or our society, International Society for History of Islamic Medicine, 20 years ago, we discovered nowadays many people, they talk on Islamic medicine. Even from Oxford itself, nowadays, 3 scholars, some of them non-Muslim scholars, they devoted a book, they edited a book, complete book on Islamic medicine. So this is alhamdulillah, because of many reasons. Now more and more people, especially scholars in the field of history of medicine, nowadays they recognized about this issue. And fortunately, for the first time in Utah State, now they began and they asked me to teach Islamic civilization for the first time. For the first time at Weber State University, I began last year to teach Islamic civilization. So this is about the most important thing about achievement. In addition to that, also Avicenna talked about what we call it now Bennett fracture. Bennett fracture, it was described by Bennett. He was a surgeon from Dublin, and he described this fracture in the year of 1882. If you go back to the canon book, you can see that Avicenna, this is the Bennett fracture. It is a fracture in the base of the thumb of the hand. And we can see that in the canon book as well, Avicenna he devoted a chapter about talking on the fractures happened in the thumb, and he described this kind of fracture, which is called until now as a Bennett fracture. Not only of that, Avicenna, you know that he edited Al-Urjuza fi al-Tib. He summarized because he recognized that the canon book is very difficult book. Actually, it is very difficult book because the language, even Avicenna himself, he is Persian originally. His mother tongue is Persian, but his Arabic, actually, it is fantastic one. It is very excellent language. He speaks very well Arabic. And he wrote his book, The Canon, in high standard Arabic language. And then, because it was approved, it is very important to any medical student during medieval age to memorize the canon book before he can practice medicine at that time, to be qualified to practice that. He recognized to how much extent it is difficult, and he moved it, he summarized it in a form of poetry, and he actually edited the Al-Urjuza and to summarize the whole canon book in the form of poetry. And he devoted special verses for talking on fractures. So these verses summarized the fractures, and then he summarized the dislocation of the joint in his book, The Canon, when he transferred it into the poetry form. Let's move to the third very important one, elbow cases. You know, many of people, they maybe not recognize that elbow cases, the only book of elbow cases is the Tasrif book, Al-Tasrif book, which is of course written in Arabic. Al-Tasrif book, it is not devoted for surgery. It is general encyclopedic book. It contains all branches of medicine in this book. And this is unlike many people believe that. Many people believe that this book, Al-Tasrif, is related to surgery only. It is not. It consists of 30 treatises. This book contains all branches of medicine, mostly related to pharmacy. So many scholars believe that Al-Bukasis should consider him the father of pharmacy and not the father of surgery. This is many people, especially pharmacists worldwide. But the most important thing that Al-Bukasis, in his book Al-Tasrif, he devoted the 30 treatises, the last treatise in his book, for talking on surgery only. And this made the Al-Bukasis is very famous worldwide, especially in Europe, because this, the treatise of his book. Just like that, he reminded me by Ibn Khaldun. You know, Ibn Khaldun, he was very famous by his introduction. Introduction, it is not a separate book. It is introduction of very big book, which is related to history. And he devoted, when he want to write an introduction for the book, it took with him complete book. And nowadays, it is the complete book is called the Introduction of Ibn Khaldun, which is more famous than the original book of Ibn Khaldun. The same thing regarding Al-Bukasis. His book Al-Tasrif is not so famous, such as only the last treatise of his. And actually, it gave me the very good, important opportunity for me to edit his last treatise and to comment it in my book, which is called Al-Jiraha Inda Zahrawi, or Surgery as Viewed by Al-Bukasis. So this is my book. This is related to only the surgical chapter or surgical 30 treatise of the book of Al-Tasrif of Al-Bukasis. This is, of course, Al-Bukasis, which was translated into English, and it was one of the most important. Our modern surgery nowadays depend on this book. If you go back to the history of surgery in Europe, you can discover that they depend on this book after it was translated into Latin language. This treatise on surgery, it is divided into 3 sections. Al-Bukasis divided into 3 sections. First one is related to cauterization and heat therapy, because until the time of Al-Bukasis, cauterization, it was very important method in treatment of different diseases. Then the second one, it is a kind of real surgery or in making incisions. This is exactly the real surgery of Al-Bukasis. Why the third one? It's related only for bone fractures and setting the dislocations, reducing dislocation. So from the third one, actually, I would like also to mention to the most important issues regarding what was achieved by Al-Bukasis in the field of bone fracture, which is actually included in the 30s. It is a part, the third part of the 30s treatise of Al-Tasrif book, which is related to surgery. Okay, but in this introduction, when he talked about some surgery, including bone surgery, such as osteomyelitis, for example, he devoted special chapter about the hemorrhage. If you are doing some types of surgery and you will be surprised to have a kind of hemorrhage, how you can control it. He actually very clearly, he mentioned the 3 ways how you can control this hemorrhage: by ligation, by cauterization, and by compression. And nowadays, we still use the 3 method of method to stop hemorrhage. But if you go back, this is again about how much our modern textbook, they ignore what was achieved by Muslim physicians during medieval age. This is considered, according to my knowledge, I'm not general surgeon, but it is considered very important reference of surgery here in America. Schwartz, I know it, this book since I was in Aleppo. The majority of our college in general surgery, this is the main reference for them. Schwartz, Principle of Surgery. In this book, when they talk about how we can stop hemorrhage, they talk about that. Historically, Celsus devised the use of ligation or ligates in the year of 100 AD. And because of the strong influence of Galen at that time, who was inclined to cautery, this method did not gain popularity until Ambroise Paré. Ambroise Paré, he is a French surgeon. He rediscovered the principle of ligation in stopping hemorrhage in 1552. So he mentioned to Ambroise Paré that rediscovered that, and no mentioning at all to what was done by Albucases, who described and who explained in detail the 3 methods of how we can stop hemorrhage, including ligation. The ligation of the artery, he in details described this method. So no mentioning at all to Albucases that he rediscovered that, but they mentioned to Paré, Ambroise Paré, the French surgeon who did that. Also, Albucases, he was very brilliant when he talked about skull fracture. When he talked about skull fracture, he differentiated different types of skull fracture, including one of them is called depression fracture. And when he said that this fracture compress the material of the brain, we have to remove this fracture and we have to remove the bone. Sometimes this bone, it's still connected with the other part of the skull. And how we can remove it. He explained actually in more details about how we can remove this bone. And in this description, he used what we call it the drill. Nowadays, we still use it nowadays in brain surgery. And to use the drill, and we make special hole, and then we can connect between these holes until we can remove this bone from the skull itself. So this is very important description, I think. And I remember that one time I attended a conference maybe 15 years ago in Los Angeles. Attended a conference about international conference in neurosciences, International Society for History of Neurosciences. They held their conferences 15 years ago in Chicago, in California University, and attended the conference. And all the people was extremely surprised when I explained to them in English. I provided the text in Arabic and the text in English of Albucases when he did such kind of surgery. Many of them, they believe that this kind of surgery, it was just developed during the last 200 surgery. And before that, it was nothing mentioned at all. And they, as I told you, they were surprised when I explained to them how Albucases did this kind of surgery to remove what we call the depression fracture from the skull. And then Albucases, he explained in more details. Sometimes he said that the fracture could be very close to the joint, and the callus, which we formed to heal the fracture, it may be contradict with the movement of the joint. It may a kind of stiffness of the joint. So he explained in more details about how we can open the callus itself here and to remove it to make the joint movement is more and more easy. Of course, we don't use this one of operation, but when you read this kind of operation, which was described by Albucases, you can recognize to how much extent He was so brilliant in doing such case. And the most important thing, the describing the instrument which was used by Albucasis himself when he do this kind of operation. These are some kind of these instrument which was used by him, especially in the field of orthopedic surgery and in the field of open to treat such kind of open fractures, because he was also very brilliant to describe the open fracture and to describe chronic osteomyelitis after fracture and how we can remove the sequestra, which is the source of infection of the bone. This is again some instrument of that. And actually, as I told you, because the time is very, very limited, I just concentrated on the most important issues, which I feel it's a kind of contribution by Muslim scholars at that time, which nowadays it is attributed to some of Western mind, and it should be corrected. That's all of my presentation, and thank you for every one of you. Thank you.
Thank you, Dr. Kaadan, for an excellent overview and presentation. I know it's not justice for you, who has written volumes and volumes of books, to come on this and give us a short presentation on that. And especially that Al-Razi, the Baker cyst, and all this information is not known to the younger generation. So I would like to ask you a question, which is a common thing in orthopedics here. When somebody falls, there is like RICE, we call rest, ice, compression, and elevation. So do you think any role of this also hinting towards our famous scholars in the past?
Actually, physiotherapy, you know that it is very important method to treat, especially the rehabilitation of the patient. And it was mentioned in more detail. Sometimes to use hot, for example, bandage, or sometimes ice bandage, or something like that. And actually, in textbook which talk on bone fractures or sometimes joint dislocations, they mention in their textbook about what we call it nowadays a kind of physiotherapy, which is complete the issue of treating sometimes fracture or joint dislocation. But as you mentioned, because the time is so tight, I couldn't explain everything about that. But it is, of course, mentioned by not only the issue of eyes, it is related to everything about what we call it physiotherapy nowadays, about rehabilitation of the patient who had a fracture or joint dislocation.
Thank you. Dr. Nagamia, you can unmute, and if you have any questions or comments for Dr. Kaadan.
Well, thank you, Dr. Kaadan, for giving such an excellent presentation. I think he tried to squeeze a lot of information in 30 minutes, which is almost impossible. He could probably talk about contributions of each of these great physicians, Islamic physicians, probably for hours. So in any case, this is the NIMS aim is to bring this great scholars to you, and for you to really benefit from the absence of the history in the current literature, current medical literature, and so forth. I also will very humbly like to point out that we as Muslims should stop using the Latinized terms for our great surgeons and physicians. I commend Dr. Kaadan for doing such a beautiful lecture, but I would want him to use not Al-Buqasis, but use his real name, which was Az-Zahrawi. We have to emphasize to the new generation that the Latinized name is not the real name of the people. That, Ibn Sina and not Avicenna, Al-Razi and not Al-Razis, not Al-Buqasis but Al-Zahrawi. So it's very important for us to start using those names so that it becomes very commonplace for them to also recognize that, no, the real name was this and not this Latinized version. So that's only my comment for the benefit of the people who attended the symposium. Thank you.
Yeah.
So thank you so much, Dr. Nagamia, for this. And for me, it is much easy to say Al-Zahrawi because, you know, my mother tongue is Arabic. To say Ibn Sina, to say Ali ibn Rubban al-Tabari, it's much better for me. But I suppose that maybe some of our colleagues maybe from India, of course, you are Dr. Nagamia, you are so famous with these names, but I maybe support that the new generation who attend this lecture, they not easy for them to recognize Al-Zahrawi, maybe Al-Bukaisis.
No,
This is why, and of course, it is for me. It's much easier, and I think the most important aim of the lecture is to inspire the young generation. This is very important. I think young generation are very, very important, especially young generation doctors, to stimulate their appetite, to go back to references, to look. So what I mentioned here is just titles. It is big titles. Everyone, if they want to explain these titles, to stimulate their appetite again, to go back to the references. Thank you, Dr. Nagamia. Next time, I will never mention to the Latinized name of the Muslim scholar. Thank you.
Dr. Kaadan, one
I
comment
think, I
from-
mean, you know, we need to mention the Latinized name only to correlate so that people understand where to correlate. But then we should always use their original Islamic names because I think it's very important to identify that these were Muslims in the first place.
Thank you.
Anyway, that's good. So I think that's a good discussion.
Yeah, Dr. Kaadan, one few
okay.
comments from our audience. One of them is Dr. Muhammad Javed Ansari. He is from Northwestern Medical Center here in Chicago. He just wanted to get your opinion or thoughts on even Dr. Nagamia. Do you think it is time for starting a medical school by Muslims in the United States?
Sorry, could you please repeat it?
Do you
Say it
think
again.
do you think it is time for starting a medical school by Muslims in United States?
Actually,
I think I can answer that a little bit more objectively. You know, the Islamic Medical Association of North America, which is the august body representing the Muslim physician in the United States, which was started in 1967. We just completed our half a century, and a book is published about the half-century existence of Islamic Medical Association. I wish all of you could read. But in that, we explore the possibility of starting a Muslim medical school in the United States. And I think it's not only a dream, it's something that we need to accomplish as soon as possible. Because as you know, every community that came, USA is a crucible of civilizations. And therefore, every community that came, one of the sort of pristine examples is the community of Jewish people that came to the United States. They have established so many medical schools. I mean, practically every state has a medical school which was established by our Jewish brethren. So there's no reason why we cannot do it. It's just the determination and the will of the Muslim community in the United States that will determine that we will form a school. Now, there is a beginning of this has already taken place. The Islamic Medical Association, together with APNA, which is the Association of Pakistani Physicians, has thought about it. They've already laid the plans, and the formulation is already in the works. And hopefully it will happen. It may not happen in my lifetime or our older people's lifetime, but it will happen in the next generation, inshallah, and very soon. So yes, the plans are there, the idea is there. Only thing is that the determination and the finances have to be gotten together, and it will happen, inshallah.
Another one, Dr. Kaadan, Dr. Sharif Al-Ghazal, saying that Dr. Al-Zahrawi advised to reduce dislocation ASAP, which we practice nowadays. This was just his comment.
Actually, yes, he took nearly all dislocation, which is well known nowadays, including the most important one, shoulder dislocation. And the most important thing he achieved, he has very important achievement in this field. He described different methods of shoulder dislocation, including what we call it Hippocratic method of dislocation. And one method could be regarded, he is the first to describe it, which is called in our textbook nowadays, the position to put the shoulder in the position of liberty status. You know that, which is this position. And actually, he described this kind of reduction. So he described many, many different. But again, as I mentioned, it was not a time convenient to talk on all types of joint dislocation.
Okay. So I think Dr. Taj, who is also one of the co-founding members of NIMS and cardiologist, is here. I'm trying to see if anybody can unmute him. He has to add something to the medical school question because he has worked hard with Dr. Nagamia. Let's see if I can unmute him, or who is handling the Zoom can unmute him. Dr. Taj is here, and I think, yeah, Dr. Taj, you can talk. You have been unmuted.
Okay. Assalamu alaikum. About the medical school question the brother raised, we have been at it from the inception of Imana. Then Imana assigned that function to me and Dr. Nagamia to explore the possibility of a med school. So for that reason, we initially started a clinic called Akbar Clinic in Florida with a thought that will expand into a large group, which a lot of people joined, and we wanted to start a medical school. But people who are redneck in that area, in the Panama Panhandle, Florida, they shot us down. So that project went down the drain. Then I thought I'll probably initiate this by joining the Northwest College, which is a science college. And we applied for a medical school. We were in line for a DO school. And we were to be approved, but it entailed anywhere from $90 to $100 million to start a school. We struggled, and we approached many people, many organizations, including APNA and others, but it did not materialize. So we had to let it go. So what I'm basically saying, that the idea of starting a medical school, leaving our footprints here, and contributing to the North American society is going to be in vain. Repeatedly will fail without very strong financial support. Unfortunately, our Muslim Ummah is not ready yet. Their donations go mostly, or at the most, up to the mosque, and that's where they start. They are not committed to education. They're not committed to studying an institution of any kind. So, but we are still struggling with that idea. The college is still there, and hopefully one day the community will realize the need for it. When we first came, there were only 4 at the most DO schools. Now there are 40. They know that, so all the Jewish brothers bought all these and started these schools. We are way behind. So the struggle goes on. So my appeal is to keep thinking, keep spreading the word. I think it's, I don't think myself and Dr. Nagamia will see that in our lifetime. Maybe the next generation task is to take it forward from here.
Well, one of the most important things, I think, is that, the Muslim community of United States has to understand that just building mosques is not enough. If you want to build a mosque, you can get $1 million within no time at all. But if you want to build a medical school requires, a DO school requires 100 million, but a medical school requires $300 to $500 million, or about $500 million. Now, I mean, there are Muslims in this country who can easily, contribute that kind of money. It's not that we don't have billionaires and millionaires in our community. We do have, but they have not come to recognize that building an educational institution in the United States is a fundamental way of uplifting our community to the next level. We have come to a certain extent, but we have stopped there. So in order to go to the next level, we have to realize, and we have to work hard, and we have to really motivate those people who can give. I mean, for a billionaire, $100 million is like pocket money, and they can very easily donate that. But the thought behind that process is still not there in the community. And we have to put the seeds into the community, hopefully in the next generation, in the next generation of billionaires that are going to happen, which is given. There will be billionaires among the Muslim community, that this is more important than building mosques. The mosque is good, but the next step is to build educational institutions, especially colleges, and medical college is one, but every other college, legal, journalistic, finance and banking, anything you can name. We should be building those institutions now.
Okay, Dr. Nagamia, could not disagree anymore. We are all on the same lines here. Alhamdulillah. Dr. Kaadan, before I let you go, I would like you to tell us for a minute or two, what challenges did you see or did you face, or how do you feel our new generation is reacting, even in Syria? Because, you know, the westernization is growing so fast, everybody has no more than 1 or 2 minutes to read anything. How would you tell us, as to the new generation throughout the globe, how to get back to their roots and see for themselves?
Actually, I think education, such as this kind of lecture, is very important, because the vast majority of the new generation, they are not aware about Islamic civilization, about what was achieved by it. So I think institutions like societies, like our society, like the Nagamia Institute, like our institute, which Dr. Nagamia visited in Aleppo. And actually, you can imagine that this institute in Aleppo graduated. For me, myself, I supervised 9 PhD only in the field of history of Islamic medicine. Everyone got PhD is a kind of army just to widespread this kind of knowledge to the old generation. So this is very important. Regarding the Islamic countries, I recommend all universities, whatever their branches, in the field of engineer, in the field of mechanics, in the field of medicine, to devote a special curriculum which is taught on the achievement of Muslim scholars in this field of science. Should be done. And you can imagine that we have about 1.8 billion Muslim people worldwide, and we have many thousands of these universities. So I think we have to recommend for these universities to adopt, to consider, to teach a small curriculum on the achievement of Muslim scholars during medieval age in this branch of science. Yeah.
Okay, thank you, Dr. Kaadan. And I think, as per your points, some Islamic schools or many Islamic schools throughout United States have this in their criteria or in their subject, which is pretty good too. So before I end, I would like Sister Alia Hirzala to give a concluding statement And I would like to thank her for her tremendous effort in putting this together, spending days and nights. So I would like Sister Alia Harzila, the Executive Director of NIMS, to give concluding statements.
Jazakallah khair. I want to thank you all for attending. Jazakumullah khair. A special thanks to Dr. Abdulnaser Kaadan for a great lecture. Dr. Hussein Nagamia, mashallah, you always add something. Dr. Shakib, thank you for doing that to us. And I want to let you know that this lecture is recorded. So you always can go to our website, nims.org, niims.org, and you can watch it. And inshallah, we have another event upcoming, inshallah, on January 16. We will provide you with all the information. And please, if you go to our website, you can sign for the newsletter. So you will receive a monthly email about all about our activities, about the lectures, everything about the exhibition, inshallah, you can receive that. So please go to nims.org and sign up for that. And at the end, inshallah, thank you thank you again, and jazakumullah khair. May Allah accept from all of us. Jazakumullah khair.
Thank you. Thank you all. Jazakallah.
Wa iyyakum.
Thank you, everybody, for attending.
Thank you.
Assalamu alaikum.